Hello, my name is Anushka Shankar, and in this video, I will aim to increase cervical cancer awareness. Cervical cancer can be defined as the abnormal growth and malignant transformation of cells in the cervix. A feature of malignancy is the ability of cancer cells to invade and spread to other body parts. Long-lasting infection with high-risk strains of human papillomavirus is the main cause of cervical cancer. HPV is actually the most common sexually transmitted infection because it can be passed through direct contact during vaginal, anal, or oral sex. This incredibly common virus has more than 100 types of strains, of which at least 14 are cancer-causing, also known as high-risk types. HPV 16 and 18 cause 70% of cervical cancers and precancerous cervical lesions. There is also evidence linking HPV with cancers of the vulva, vagina, penis, anus, and oropharynx. Low-risk HPV types, such as HPV 6 and 11, can cause warts, which are non-cancerous. However, warts are still contagious and must be treated. Risk factors for cervical cancer have been listed in the slide. Factors such as multiple sexual partners, unprotected sex, young age at first childbirth, and multiple pregnancies are included because they essentially increase the risk of contracting HPV infection. Immunosuppression is a risk factor because it reduces the body's ability to fight off infection. Signs and symptoms of early-stage cervical cancer have been underlined. As cervical cancer advances, more severe symptoms may occur. These are presented in white. India has some of the world's highest rates of cervical cancer incidences and deaths. Cervical cancer is the second most common cancer in Indian women, with breast cancer being the first. Such a high incidence of cases can be attributed to a lack of personal hygiene, which leads to HPV infection, as well as poor access to vaccinations, screening, and treatment. Prevention is better than cure, and cervical cancer can be prevented. This image describes the progression from normal cervical cells to HPV infection, precancer, and eventually cervical cancer. After HPV infection, the rest of the process can take years to decades. Intervention with vaccinations and screening and treatment at the appropriate stages can arrest progression and increase survival. Screening can also detect early-stage cancer, which, with treatment, has a high potential for cure. In fact, the survival rate is close to 100% when precancerous or early cancerous changes are found and treated. Many people have HPV and don't even know it, which means one may unknowingly transmit it. Oftentimes, infection doesn't cause any noticeable symptoms or health problems. The majority of HPV infections, both high risk and low risk, go away on their own within 2 years without the need for treatment. In fact, most people will have an HPV infection in their lifetime, which a competent immune system would clear. Only a small proportion of infections with high-risk HPV types can persist and progress to cervical cancer. There is no treatment for the virus itself. This is why primary prevention in the form of HPV vaccination is crucial. The HPV vaccine can prevent infection by the strains of HPV most likely to cause cancer and genital warts. Ages 9 to 14 should receive 2 doses over 6 to 12 months. The vaccine is most effective when administered in this age range where girls are not yet sexually active. Ages 15 to 26 should receive 3 doses over 6 months. Vaccinating ages 27 to 45 involves shared clinical decision-making, while vaccinating above 45 years is not recommended. The vaccine may also be given to boys. Condoms should be used during sexual activity to reduce the risk of HPV infection. Always practice safe sex. Secondary prevention of cervical cancer involves screening plus treatment if a precancerous lesion is found. The aim of screening is to catch the disease in the precancerous stage. Starting from 25 years of age, a woman should get a pap smear done every 3 years. A pap smear helps in detecting any abnormal cells. Starting from 30 years of age, a woman should get the HPV test done every 5 years. This test detects the presence or absence of the human papillomavirus itself. If done together with a pap smear, it is called a co-test. Visual inspection with acetic acid, also known as the vinegar test, is an inexpensive screening test that makes use of acetic acid. When brushed on a woman's cervix, precancerous lesions turn white and are essentially highlighted. This test has been especially helpful in developing countries. Treatment strategies of precancerous lesions include thermal ablation, cryotherapy, LEEP, and conization. This slide illustrates and outlines the pap smear procedure. A negative pap test means that no cell changes were found on the cervix. This is good news. In this case, screening should be continued as normal, that is every 3 years. In case of an abnormal result, the doctor would recommend further follow-up with colposcopy. A magnifying colposcope is used to examine the cervix more closely. During the colposcopy, the doctor may take a biopsy of suspicious lesions for further evaluation. Cervical cancer can be treated with surgery, chemotherapy, and/or radiotherapy. Even after being cured of cancer, it is important to go to follow-up consultations with the doctor to ensure accurate eradication and to deal with any side effects of the therapy. Also, be sure to seek out counseling therapies if dealing with negative emotions and stress. The risk of HPV transmission to the baby during childbirth is low. Even if babies do get the HPV virus, their bodies usually clear the virus on their own and the babies are very rarely affected. Still, it is important to inform your doctor of your HPV status. The COVID-19 pandemic has unfortunately disrupted cervical cancer screening. With improvements in the pandemic situation, screening of cervical cancer should again resume with full force. Thank you for watching and stay safe.